Okay, so we are going to, be looking at the cerebral cortex. Okay, so let's begin by writing out, and to me, this is going to fit on the bottom half of your paper. Okay, so what I would do is I would draw it about, maybe 3 inches, in the middle. Okay, so it kind of looks like a boxing glove, but that's what our cerebral cortex, how we're going to draw it. Okay, so this is the newer structures of our brain, and this is what really makes us human. It's also called the cerebral cortex and the forebrain. So let's take a look, at the lobes of the brain, and I'll give you some mnemonics to do along the way. So the first lobe that we're going to look at is the frontal lobe. Okay, this one you could use colors, you don't have to. I'm not coloring them in or anything. Okay, so the very first lobe we're going to talk about is the frontal lobe. And this is, the primary function is executive functioning. So what I mean by that is this is our higher level thinking. This is impulse control, planning ahead. Our personality is located in the frontal lobe. So all of that has to do with executive functioning. Now at the very back of the frontal lobe is what's called the motor cortex. So it's just a thin strip, that you can draw. And the very back of the frontal lobe is called the motor cortex, and that is responsible for our voluntary movement. The next lobe is the parietal lobe, and this has to do with touch. Now, just like the frontal lobe, we have the, at the very front, instead of the very back, we have what's called the somatosensory cortex. Notice that word soma again, for body. So this is sensing our body cortex. Now, what we're going to look at here, and this is kind of creepy, it almost looks like science fiction, is that these strips on our cortex are not equal, so it's not proportionate to our body. So if you were to think, let's say for movement, what parts of our body, and think of anything, like it can be from our head to our fingers, what parts of our body have to do a lot of different movements? Is it with your legs, is it that different? Is it moving in multiple directions? Your arms? Yeah, so why would it be like your mouth and tongue? Yeah, the language development. So look at this, and this is really creepy. Well first, this is what it looks like in the brain because the drawing's not too bad. But here, look at that. So, I know. So what this is called the homunculus, and this is the motor homunculus. So if our body was proportionate to our motor cortex, that's what our body would look like. So you have the hands have a lot more, and the mouth and the tongue because of language. So this is what it kind of looks like if we were to take the strip. Okay, so you can see there the face is almost as big as the leg. Okay, and really, yes, our leg it gets us around, but it really only moves one direction, right? Okay, your hip can move is like a ball joint, okay, but your knee is a hinge. Okay, so we have a lot more for our hands that we have to do and our face. So somatosensory, kind of similar. Okay, I know, it is quite creepy. Okay, so this is the sensory homunculus. Okay, and doesn't this make sense? How many of you, a paper cut hurts way worse than like a giant scratch on your forearm? Okay, couple different reasons. Okay, first, we have more sensory receptors in our fingers, but we also have more parts of our brain designated to that. So a tiny paper cut can bother us, but I might not even notice. Let's say I'm out doing yard work and I scratch my arm. I might not even notice. Somebody will be like, oh, you're bleeding. Oh, didn't even realize. Okay, so there's not as much of that sensory cortex. And this is how we experience phantom limb, or somebody would. I wouldn't. Okay, so yet, hopefully not. Okay, but let's say their arm is amputated for whatever reason from the elbow down. Okay, if that happens, sometimes people still feel pain in their hand or their arm, even though it's not there. That's because that part of the brain still is there, and it's like sending false messages. So people may feel pain in something that's not even there anymore. Okay, yes?
So is that like the thing, so like on your back, you don't have a lot of, not, I guess, receptors? So like my sister did it to me, so you can like have two fingers or like one finger?
Yes.
And like you won't be able to feel like
correct. Yes. Yeah, so if we were to do something like that, on my fingertip, I would be able to tell, I think about an inch apart that you're pressing with two fingers. But on my arm, it might be like 3 inches apart. Yeah. Yep, that's exactly why. Okay, so this is what it looks like with the somatosensory strip. Okay, I just feel like the 3D model is just so much more powerful. I don't know if that's the right word. Inspire. Yes, it's just, and then just think, somebody created that. Okay. I'm making it a homunculus. Okay, so the next one is the occipital lobe. And the occipital lobe has to do with vision. So what are we talking about with the occipital lobe? What this is, okay, this is where we perceive vision. So if there's specific parts, like we can look at like a association area, so then that brings in memory. Okay, so I may have spots that are like for faces. So there are people who, if they have a stroke in a certain part, may not be able to recognize faces anymore, like the differences in faces. We're going to take a look if somebody has a stroke and it affects their occipital lobe, something called visual, oh, just kidding, we're not going to do that yet. Okay, 4, temporal lobe. Thought it was coming up. But going back to the occipital lobe, that there is with the occipital lobe, that there's something called visual neglect syndrome. So people aren't aware of half of their visual field. And they're not really aware that they're not aware either. Okay, so we'll watch a video on that. Now the temporal lobe has to do with hearing, and the location is kind of by your ear, and your ear hears. Okay, so I do have a way for us to remember this, okay, with the mnemonic devices. Okay, so the first thing is looking at the frontal lobe, and I'll go to the front if I need to edit this up. Okay, so the front of the classroom, I want you to think as the frontal lobe. Okay, the frontal lobe is kind of executive functioning. You're learning new information. You're planning ahead when I put the dates and stuff up here. Okay, so that is going to be executive functioning. The ceiling is the parietal lobe, and I can't touch the ceiling. Okay, so the ceiling's the parietal, and I can't touch the ceiling. The back of the classroom is the occipital, and I have a hard time seeing from the back of the classroom. The temporal lobe is our next classroom, and I hear the class. Okay, so let's do this together. What's the front of the classroom? Frontal lobe. Okay, and what's frontal lobe do? Executive functioning. Okay, the ceiling is the parietal. Yep, you go with it. You'll recognize it, right? The parietal lobe, and I can't touch the ceiling. The back of the classroom is the occipital, and I have a hard time seeing. To me, too, occipital and optical, like I feel like if I rearrange the letters, that I'd be okay. I think there'd be a few extra, but it's fine. Okay, and then the temporal, the classroom next to us is the, and I can hear it's in there. Okay, so let's watch this video. I always, especially with the brain, I could seriously teach a whole class about the brain. It's so fascinating to see the behaviors. I probably don't know enough to teach a semester's class, but I try to find different case studies whenever we can. So here's a case study of people who have had some type of trauma. So it could be because of a stroke, I suppose a tumor if they had to remove part of the brain. Okay, but this is hemispatial neglect syndrome. So you're going to see a couple of these patients, and basically they forget half their visual field. So they may shave half their face or put makeup on half their face because they just don't realize it's there. Okay, so let's watch this, and you can see some of the tests that they're going to do.
Yeah, because I know my neighbour often visited.
The middle one is the right.
They used to always eat on the right side, but not the left side. So leave that.
Give her a dinner plate and she'd only eat the vegetables and leave the meat, which is disappointing because I was a cook.
So if you start a picture, it can not fit in the paper. It gets over to the left because it hasn't left enough room.
Spatial neglect is a syndrome, that is signs and symptoms that patients most frequently have after stroke, but sometimes in forms of Alzheimer's disease, where they ignore one side of space. So people, objects, and sounds on one side tend to get ignored, and the patients who have it tend to be drawn to the other side. And this can extend to things like the food on the plate in front of them. They'll only eat food on this side and then say they're finished. It may extend to parts of their own body. So when trying to shave, they may shave this side of the face and miss out this side, put makeup on.
So you can only see from across there.
But from there to there, that's more visual.
So what's going on in the other half?
Nothing.
Nothing at all.
So often I come up from this side to give you something.
Anybody can creep up more of their foot when
You
you go over
doesn't
there.
see anything.
I can't sense them.
So if you just look at me and just point at the finger that moves, okay? I'll say both, but which finger moves.
First one. That one.
Okay? Look at me.
That one.
Okay? Look at me.
That one. That one. That one. That one. That one.
They tend not to describe the condition, to be honest. But one of the most intriguing things about it is that this sort of loss of attention for one side of space doesn't leave a great gaping hole. And that's why it's very useful to contrast it when someone's got what's called a hemianopia, which is a primary sensory deficit. They can't see that side of things, and they know they can't see it, so they're constantly moving their heads like that. Whereas patients with neglect are unaware of their deficit, that they're not even aware that they're missing something, because their sort of imagination space has gone from that.
So if I were to, let's say, if I were to go blind in my left eye, okay, so I'm just going to close it. and I wanted to see something over here, I would go like this. Okay, people with this neglect syndrome would turn around this way. Okay, because they're just not aware of it. Okay, so any questions? I don't know if I can answer them, but I'll try.
Do they just kind of forget if someone tells them, like, you can't see, like, this side, or?
Yeah, it's just that, and I think he did a good job of that. They really can't explain what it's feeling like. It's almost like my awareness is what it is right now, and it almost be like not. It's like you don't know that you don't see it, if that makes sense. And it kind of does, but yeah. Any other questions?
So would it just be like pitch black?
That I don't know. I think it's more of just like, think about this. Behind my head, okay? Behind my head, I can't visually see, but it's not pitch black. That's kind of how I picture it. Not sure if that's accurate. I do not know much about this at all. So I just find it really fascinating. Okay. All right. So let's go to some other things then with the brain. Okay. And we're going to talk about language and then look at language deficits. Okay. So the first one is Broca's aphasia, and Broca's area, and that is in the frontal lobe. So that's that light blue. So Broca's area is the productive expressive language. So you raise your hand, you ask me a question, that's your Broca's area. You have a conversation with friends and you're able to talk, Broca's area. You produce language. The purple then is Wernicke's area. And this has to do with comprehending and understanding language. And that's in your temporal lobe. So, a few things just to talk about. Wernicke's area is that if somebody were to ask you a question, you would understand what they're saying. How many of you, I'm assuming probably most of you, have been in a foreign language class? Okay, so you probably were able to understand what your teacher was asking you before you could speak it. Okay, so you can understand, and that's how our development works. Kids, babies, their Wernicke's area develops first, so they can understand what, let's say, a caretaker is telling them, but they themselves can't produce the language. Okay, and I think the best way to show this is to show the when it's not working. Okay, so I do know quite a bit about this from personal experience because my mom had a stroke. So at age 46, she had a massive stroke that if I were to, let's see. Okay, so it was primarily her Broca's area, but if you were to look, it kind of was like a giant rectangle right here. Okay, so with a rectangle, like if you were to look at her CT scan or MRI, she just has a rectangle hole in her brain. It just filled with cerebral fluid. Okay, so she had, after her stroke, she was not able to talk at all. And she had total right side paralysis because it was in her left hemisphere. So when I say not talk at all, at first she couldn't, and then now she's I would say about 85% of what she was. But I remember them bringing in a box of just everyday items. And so let's say this. They would show her this. And she would just kind of mumble something. And they say pen. And then she would say pen. Okay? And then they'd hold this up. Okay? A stapler. And she'd say pen. And then they have to say no, stapler. Stapler. Okay, so she wasn't able to produce. So it took about 6 months, I'd say, before she was able to have a conversation. So if I were to ask her, do you want something to drink? She's not going to say, yeah, I want a glass of water. She'll say water. Okay, so that's kind of how the Broca's area works. Wernicke's area is understanding. So here's an example of her not understanding. During her therapy, they said, bend your knee. Okay, and she bent her arm. Okay, so she understood the bend part, but didn't quite get the elbow versus the knee. Okay, so let's take a look at what this is. This is called aphasia, and you can write this just right below it, okay, because they have to do with each other. Okay, so aphasia is a loss of ability to communicate. And you can have Broca's aphasia or Wernicke's aphasia, or both, depending on the case. So aphasia means you can't talk. So Broca's aphasia, you can't speak. And Wernicke's aphasia, you can't listen. So let me give you an example of this. Okay. Well, first, I should give you my mnemonic. It'll make more sense. So I'll let you finish copying this down. So here's a really, really stupid mnemonic. This might be the dumbest one I have, okay? So if you look at me, okay, we're going to go Broca's beaks, Wernicke's wistens. Broca's beaks, Wernicke's wistens. So what does that mean? I speak. I can produce language. Wernicke's, I can listen, and understand language. Okay, so listen is a lot more than just I can hear what's going on. I'm listening, I can understand what's being said. Okay, so I think the best way to show this is I have two examples here of Broca's and Wernicke's aphasia. So up on the screen, we're going to look at Broca's aphasia. Now, Sarah Scott is a teenager. Okay, I think she had the stroke at 17, so she's 19 here. Okay, and she has Broca's aphasia. And I want you to notice how is she following along? So if somebody asks her a question, is she responding appropriately? It might not be fully, but is it generally answering the question? Okay, and see how it's following along. And then we'll compare that to Wernicke's aphasia.
Okay. So what's your name? Scott. Oh, no. Sarah Scott. That's right. And how old are you? I can't. Try. I can't. You're 19. 19. And what happened to you? Stroke. You had a stroke last year? Yes. And what happened? Can you remember what happened? School and English class. Okay. And I book and I read it aloud. But I can't because stroke. So I send and also it's the same as kind of thing as you know, pins and needles. Yeah, like the same, and also arm as well. Leg. Yeah. And what happened after the stroke with your speech? Well, I can't. You have speech problems? Yeah. Do you know what that's called? Yeah. Aphasia. Yeah, good. I haven't heard you say the word before. I wrote it down. And that helps? Yeah. Okay.
Okay, so any questions on Broca's aphasia? Yes?
So can she imagine the response?
Well, that's an interesting question, and I tried to ask my mom, and she kind of forgot everything. I mean, it was pretty traumatic because she was getting treatment Okay, so she had speech, occupational, and physical therapy 3 times a day. So the best way to describe it is it's like you know it's in there, but you can't get it out. Okay?
On like the tip of your tongue.
Yes, but I think it's probably more frustrating than that.
It's like you know, it's like when you forget a word,
Mm-hmm.
you know what it is.
Yeah, and I would say it's almost like, I think if we can take it a level deeper, it's like you know you want something, but you don't have a word for it. Like, let's say you wanted a glass of water, but you didn't know how to say glass of water.
It's like speaking in Spanish.
Yeah. So, here's the thing. Speech therapy works a lot, and one thing that my mom really appreciated with me was that I would just sit there and wait for her to talk. Okay, because it's not going to do anybody any good if I'm talking for her. It's kind of like building a new muscle. Okay, that if I do it for her, okay, it's not going to work. And this is where we talk about neuroplasticity. So basically, I guess I don't really need to draw this. Picture a road that has a bridge, but the bridge is gone. The road is still good. Bridge is gone. So you can't build a bridge there because it's never coming back. So you have to build a new bridge to connect the roads. That's what speech therapy does. The younger you are, the better your prognosis, the more plasticity we have in our brains. Okay, so that's kind of what we have to picture. So she's writing it out. Okay, that's one way that's going to help her figure out the word. Did you have a question?
No.
Okay. Any others? Yes.
How do strokes happen?
Strokes happen one of two ways. One is a blood clot, and then your brain's deprived of oxygen. That's the more common one. The other way a stroke happens is there's a brain bleed. And I'm not quite sure what the difference is between that type of stroke and an aneurysm. So it's wherever the neurons, where there's blood, they're done. So there was actually a woman who, one book that really helped me was, it was called My Stroke of Insight. A neuroscientist at the age of 37 had a massive stroke, the bleeding one. And she lost all language ability. Okay, and I felt good reading this because she wrote a book. So obviously it came back, you know? So she just talks about how, like, especially with the language, the Wernicke's aphasia, that she would see words and they just looked like a bunch of nonsense syllables. So for me, I can't read Chinese. Okay, so it would be like looking at those words, but there's words that you've been familiar with your whole life. Okay? So kind of the same thing, everything was just kind of jumbled together. So let's look at Wernicke's aphasia. This we have a more traditional patient. This is a person who is elderly. Okay, which I know for my mom, she had a hard time because she wanted to, like she was going to go to, what was she going to do? She was going to go to like a support group, but everyone was in their 70s and 80s, you know, because you typically are going to get strokes when you're older. Obviously, it can happen when you're younger. It's just not as common. Okay, so here is Wernicke's aphasia. You'll notice the difference.
Thanks. And say, baseball player, baseball promotion. Caterpillar, kangaroo. Okay. All right, I'd like for you to do some things now with your mouth. First thing I'd like for you to do is stick out your tongue. Show me how you would kiss. Show me how you love to kiss me. Show me how you sit on a straw. Can you sip on a straw? See what sticks under me? Okay, try this one. See, wait a minute. Show me how you smile. Show me how me. Can you smile? Can you smile at me? Don't stare at me. Don't say what I say. I want you to do this. Watch. What? Look at me. Smile. There you go. That wasn't a very good one. Smile. Smile. There you go. Chew. Show me how you chew gum.
So was there a problem producing language? Just produce, like, could she talk all she wanted? Yeah, so there was no problem producing. Like, she could form, it wasn't words, okay? But this, I always think, too, Wernicke's worse, okay? Because you can produce all the words, but was she making sense? Was she able to follow along with the speaker, her speech and language pathologist? No. Was she able to repeat words back? No. Okay, so it's kind of like it's jumbled up, and it depends on the severity. So one example, that's a very severe case that we just saw. An example of what my mom shared, and this is the best analogy that I could think of, was she still has problems if she's around a lot of people and they're talking. Okay, and I tried to equate it to if I were to, I kind of know some things in Spanish, I've forgotten most of it, but I think probably most of you can relate if you've learned a language in high school, not if you grew up bilingual, but you're put in a room with a bunch of native Spanish speakers. You know some Spanish. Okay, is it going to be hard to carry on a one-on-one conversation with somebody who's speaking Spanish if a bunch of people around you are speaking Spanish? I might be able to pick up words and phrases, but it's going to feel like I'm not really understanding anything. That's kind of how I would describe what she would feel like, which is really draining. So are there any questions on Broca's or Wernicke's aphasia? Which one do you think's worse? Yeah, you wouldn't really be able to speak language because you can't understand it either. In order to speak it, you have to know the correct rules of grammar, which in this case, they probably don't. Okay. So here's what, yes.
So for the reference one. So
Okay, we got 4 minutes. You guys don't got to pack up yet.
Is she writing down the words?
Yes.
So she remembers all the words.
It depends. I would guess that she would have a hard time still produce, because that's another way of producing the words. It's just another pathway out of the brain. You would still need Broca's. So for her, what it was, she wrote it, then read it, and then it helped her say it. Yep. Here's what my suggestion is to you. Okay, we have a lot of vocab in this unit. It's going to be over 100 terms. So I would be looking at Quizlet if I were you. Okay, and if you can spend 15 minutes in the next 2 days, that's 15 more minutes than you have to cram next week, Tuesday. Okay, this is not a test that you can really cram for. Okay, so you want to make sure that you're keeping up with the vocab. So that's my suggestion to you, all right? And maybe do some of the module reviews in your textbook that you have at home. Okay, so with that, now you may pack up. Don't line up at the door, though. Mm-hmm. Hold on. Where's my, I don't know if I recorded anything. Hold on 1 second because I want to answer that. Don't want this to continue. Oh boy.